Hi, this is Dr. Lara. Today I'm here to talk to you about buck teeth. Who remembers that cute cartoon beaver in the old 1950s Ipana toothpaste commercials named Bucky Beaver? He was a cartoon mascot created by Disney, and he would sing songs about brushing his teeth with the new Ipana, and he pointed to his very large, very prominent front two teeth. He was a perfect description of buck teeth. Now, what many people think of whenever they hear the term buck teeth is a front tooth or several front teeth that have protruded out so that it looks like they are the only thing you see when you look at that person. What a dentist thinks of when they hear the term buck teeth is that that patient may have a class 2 malocclusion. The word malocclusion just means bad bite. In a bad bite like that, the upper and lower jaw do not fit together properly. The lower jaw can be retruded and the upper jaw seems to be out too far, causing the lip to appear more prominent. In severe cases, a patient may not even be able to close their lips over those prominent front teeth. So, what causes buck teeth? Buck teeth can be caused by several different things. It can be a problem with the angle of the teeth. It could be a problem with the position of the teeth, and it could be a problem in the jaw relationship. With tooth angulation, that is usually caused by some type of habit like thumb sucking or pacifier use, where the thumb or the pacifier causes the permanent teeth to come in at a forward angle rather than down toward the lower teeth. The problems with tooth position may be caused by someone who has a very small jaw and the teeth do not have room to come into their proper position in a straight curve. In those cases, the tooth may come in outside of that curve where they have room to erupt. In a problem with jaw relationship, in most cases it's because the lower jaw is too small. This can be caused by some genetic influences. It could be caused by an injury that has damaged the jaw and stunted its growth. It could also be caused by some degenerative arthritis or a problem in the jaw joint that as that degeneration occurs, the lower jaw shrinks back, causing the upper jaw to be more prominent. Why are buck teeth a concern? Aside from the obvious cosmetic implications, there are also some health concerns with buck teeth. There are problems with chewing. When the upper and lower jaws do not fit together properly, food cannot adequately be chewed. This can cause a problem in digestion, as chewing is the first step in our digestive process. If it's not done adequately, then the food is not properly digested. Another problem that can come from buck teeth is a speech impediment. There are many letter sounds that are affected by the position of the upper front teeth as it hits against the lower lip and the tongue that can be affected. And also there can be some airway concerns that are commonly correlated with buck teeth. The buck teeth do not cause the airway problems, but it is very likely for a person who has a narrow arch, a small mouth, or a retruded lower jaw to have a very small airway, which leads to things like snoring, sleep disordered breathing, and sleep apnea. So how can buck teeth be fixed? Depends on the severity of the case. In a minor case where it's just a problem with the tooth angulation or tooth position, that can typically be fixed with orthodontics. When it's a minor tooth movement involved, you can use invisible aligners like Invisalign. If there's more tooth movement that needs to occur, including changing the position of back teeth, then you're going to be looking at traditional braces, brackets, and wires in order to do that. This is very commonly used in young children and adolescents who have some growth potential. An orthodontist is able to use that growth potential to help the lower jaw catch up to the upper jaw and create that perfect bite relationship. When you have a severe case where the lower jaw is extremely retruded, or if a patient no longer has any growth potential and they're an adult with a retruded jaw, then jaw surgery may be necessary to correct that appearance of buck teeth. One thing that's important for you to know is what not to do if you have buck teeth. It seems like in this day and age, we can do it yourself for anything by watching a YouTube video or seeing something posted on social media. You do not want to do this with your buck teeth. There are some scary examples of what can go wrong. It's very important that tooth movement be monitored by a dental specialist so that we can confirm that the tooth movement is not causing any harm to the tooth roots or to the jawbone around it. If you don't believe me, I want you to Google gap bands harm gums. And the image that shows up there of a case where a patient tried to close their front teeth with protruding buck teeth by using rubber bands is pretty gruesome. So don't do it yourself. Come to see a dentist that we can help you take care of that problem. I hope that answered all of your questions about buck teeth. If you have more, go to definitiondental.com and read the full blog. Thank you so much for watching.